Hello friends, monode sign and air crescent sign can look surprisingly similar, but they represent two very different pathological processes. Can you tell them apart? First, the monode sign. Here we have a pre-existing pulmonary cavity commonly related to previous tuberculosis or another chronic structural lung disease. Inside that cavity is a rounded fungus ball or aspergilloma. Notice the crescent of air between the fungus ball and the cavity wall. That is the monode sign. And here is the important clue. The fungus ball is usually mobile and may change its position when the patient's posture changes. Now compare this with the air crescent sign. Classically, this is associated with invasive pulmonary aspergillosis, particularly in neutropenic or severely immunocompromised patients. Here, the crescent of air is related to cavitation and separation of necrotic lung tissue. So, unlike the monosign, we are not simply looking at a freely mobile fungus ball sitting inside an old cavity. So, remember the fundamental difference. Monode sign, air surrounds a fungus ball inside a pre existing cavity. Air crescent sign, air outlines necrotic lung tissue during evolution of an invasive lesion. One represents colonization of an existing cavity, the other classically reflects tissue necrosis and cavitation in invasive disease. Here's the easiest way to remember it. Monode equals mobile fungus ball. Air crescent equals necrotic lung. Similar looking crescents but very different clinical contexts. Save this comparison, and the next time you see a crescent of air on chest imaging, ask yourself, what exactly is the air surrounding? Thank you.